Hello friends and dear students, welcome back to my YouTube channel SS Pediatrics. So my today's topic is in continuation with the previous topic, that is hearing loss. So in my previous video lectures, I was already discussed with you regarding the types of hearing loss, causes for the hearing loss, and in my today's lecture, I will discuss with you regarding the diagnostic measures for hearing loss. So I will discuss with you regarding the various tests which were used to perform in order to identify the proper auditory functions. So there may be some of them I will discuss with you. First is the tuning fork test and pure tone audiometry test and speech audiometry and tympanometry. So let's start with the topic. Diagnostic measures for hearing loss. First, we have to take the history of the patient and physical examination, in which we have to perform two tests, Rene and Weber test, audiometry and tympanogram. As I mentioned, test for auditory function. First is tuning fork test, pure tone audiometry and speech audiometry and tympanometry. First is tuning fork test. This test used to be performed to differentiate between the conductive and sensorineural hearing loss. In this we have to perform two tests, Weber and Rene test. Weber, in this we have to place the tuning fork in midline of skull and vibrations are transmitted by bone conduction. If this is normal, then the vibrations perceived equally on left and right, and in case of sensorineural hearing loss, it lateralizes to better ear, and in case of conductive hearing loss, it lateralizes to affected ear. Next, in Rene, we used to compare the level of air and the bone conduction in the same ear. In case of air conduction test, tuning fork just placed outside the ear canal, and in case to check the bone conduction test, tuning fork is firmly placed against the mastoid bone, and if the result is in case of normal hearing, the air conduction is more than the bone conduction, and in case of conductive hearing loss, bone conduction is more than the air conduction, and in case of sensorineural hearing loss, air conduction is more than the bone conduction, but both equally depreciated. In this, you can see how we used to place a tuning fork on the skull in case of Weber test, and in case of Rene test, we used to check the bone conduction and the air conduction. In the Weber test, lateralized and midline. In case of lateralized, Rene test on the lateralized side, plus positive Rene test indicates the sensorineural hearing loss on the non-lateralized side, and negative indicate the conductive hearing loss on the lateralized side. And in case of negative midline Rene test on both the side, it indicates the bilateral symmetrical conductive hearing loss, and in case of positive Rene test on both the sides, bilateral symmetrical sensorineural hearing loss. Next is the pure tone audiometry, used to identify the hearing threshold levels of an individual, enabling determination of the degree, type and the configuration of a hearing loss. Normal hearing, both air and bone conduction will be superimposed at each test frequency between 0 to 10 decibel. Conductive hearing loss, air conduction is less than or normal the bone conduction. In case of sensorineural hearing loss, both air and bone conduction below normal the threshold at any frequency tested. This is a mixed hearing loss. Next is tympanometry. An examination is used to test the condition of the middle ear and mobility of the eardrum and the conduction bones by creating variations of air pressure in the ear canal. It permits a distinction between sensorineural and conductive hearing loss when evaluation is not apparent via Weber and Rene testing. Can be helpful making the diagnosis of otitis media by demonstrating the presence of a middle ear effusion. You can see in this graph the type A indicating the normal tympanometry results, and in case of abnormally compliant, that is AD, and in case of A S indicates the stiffness, and B, presence of non-compressible fluid within the middle ear space, and C indicating the eustachian tube dysfunction. So this is all about my today's topic, diagnostic measures for hearing loss. I hope you all were clear with the topic, and if you want to listen some lectures regarding the pediatric nursing, then please subscribe my channel SS Pediatrics, and please like and share my videos. Thank you.